fluoridation and those against all argue passionately in support of their positions. What advice would you give the average citizen about where to go to find reliable information in order to make their own informed decisions about what's best for them and their families? So where's the best place to go for good information?
The internet is a wealth of information. There are two main sides of this. One is the American Dental Association, and the Center for Disease Control is dental division is run by just a few dentists, ex-military, who follow the party line of the American Dental Association. If the American Dental Association says jump, the Center for Disease Control jumps. That's not the way it's supposed to be, but that is a source. American Dental Association, ada.org, cdc.gov. That is one side of the research. If you want my opinion, more balanced, then I think one of the best places is fluoridealert.org. Not the com, but the org. fluoridealert.org. And that will give you lots of the research studies. It will also give you some of my side of the fluoridation, but it will also give you a lot of the research. There's a slweb. I don't know if it's com or slweb, and it also has a lot of the research on it that's very good. But if you only look at government publications, you'll only get one side of the research.
And I would just like to add also, you have to look at the risk versus benefit ratio in doing things. And putting something in a substance like water that is critical to life and that we all have to use all the time, and none of us are the same, we have to look at what he's saying and look at the literature and look at some of the research. And in doing that for myself, I came to the very sound conclusion that it's not a good balance of risk versus benefit in the water. There is research that fluoride can help with cavities when applied to the tooth with topical applications, and people would have the choice to do that. So that is what we have to keep going to. Give the people the choice. When you put it in water, there is no choice, and the risk versus benefit ratio is, in my mind, dangerous.
Thank you, panel members, on that one. Asking more about the ethical concerns. When doctors and dentists prescribe medication or recommend medical procedures, they obtain informed consent. What are your further thoughts about the ethical considerations of adding fluoride to drinking water without the informed consent of the community?
I don't think that's right, because people need to be able to have lots of information. And when, like I said, when I first started practicing, we were told to give a certain amount, and later the position was changed. So I don't want to be responsible for, if it comes out later that it's not a good idea to have it in water, I don't want to be responsible for that decision. I'm also a citizen. You know, I'm a dentist and a citizen. I don't want to drink it in my water. I don't want my family to drink it in their water. I would like for my patients to not have to drink it in their water.
It would not be legal for me to prescribe you any fluoride, any one of you here. None of you are my patients. If you wanted fluoride, you could go down to the pharmacy and ask them for some fluoride to ingest. They wouldn't give it to you. It's a prescription item. And yet, without a doctor's prescription, without knowing whether I need it or not, without knowing whether I even have any teeth, the Water District gives everyone fluoride, even though we know that infants should not have it, and above the age of 8 doesn't do any good. So there's this little window of a few children that are swallowing the fluoride. It's given to everybody, regardless of whether you want it or not, over a lifetime. And the doctor there is no doctor. The FDA has been petitioned several times to make this FDA approved. And every time, except in bottled water, where they did not go through the approval process, the applicants, they've always turned down. In 1975, Drug Digest said there were some 35 different applications for fluoride supplements with vitamins, etc., etc. Every single time the FDA turned it down. Why? It doesn't work. They didn't even look at safety. They said it doesn't work. We can't approve it. It doesn't work. I mean, that should be enough information right there.
Thank you. You've shown us startling images of dental fluorosis, or enamel fluorosis, as Dr. Pollock, or Professor Pollock calls it, the mottling of the teeth of children, well, all people, in fluoridated communities. Is this really just a cosmetic effect, or might it indicate other adverse effects of fluoride on the rest of the body?
The concern is cosmetic. If I took a key and I came up to your car and I scratched a big scratch on it, it's only cosmetics. Don't worry about it. It's just cosmetic. But it is damage. And if you did that to my car, I'd say, would you mind paying for it to be repaired? You as voters need to pay for the damage of the fluoride on people who are getting dental fluorosis. That's only fair, because it's the voters, it's the people, it's the water district that should be paying for the damage. So dental fluorosis is cosmetic. And some people say, I don't mind it. And some people say, please fix it. We showed pictures of people who wanted to have it fixed. However, it also is a sign that the tooth is more brittle and it will fracture more. Anybody have a crown? Anybody have a tooth that's broke? Anybody had to have a root canal because the tooth split, cracked, and then had to have it pulled out? I mean, it goes on and on and on. And then you can have an implant, and then you can have it replaced, and then you can keep on going on. It's lucrative for the dentist, and I think that's part of the reason why the dental expenses don't show any benefit, because we dentists don't like to look at the risks.
Thank you. The Public Health Officer of Sonoma County has identified 5 pillars of improving dental health. Do we need all 5 pillars, or would dental health in Sonoma County improve by focusing on 4 pillars only? 1, access to dental care. 2, dental sealants. 3, fluoride varnishes. And 4, education, and omitting the 5th pillar, water fluoridation.
Yes, I would agree with that. I would agree with limiting to the 4 pillars and stopping putting it in our drinking water. We do not need it in the water. The studies that I've looked at don't show that it reduces decay significantly. And my feeling is the focus definitely should be on education and prevention in the office with the sealants and the fluoride varnishes. I would agree with that.
And I agree also. There's one problem here that irritates me, is when people say that there's lack of access. I have never turned anybody away if they had money. It's not access, it's money. And I've always told my patients when they come in, I will do all of your dentistry for the price of your cigarettes and your booze. It's a choice.
Good one. The public water supply in one of our cities, Healdsburg, has been fluoridated for many years. If dental health is significantly better in Healdsburg than elsewhere in Sonoma County, this might sway some opinions. If not, we may be able to save several $1 million by not fluoridating elsewhere. How would you go about designing and financing a study to compare the teeth of those who've been drinking fluoridated water in Healdsburg all their life with those elsewhere in Sonoma County who've been drinking unfluoridated water all their life?
I love it that you want to have some research. This is the biggest problem with fluoridated studies. There is not one randomized controlled trial in fluoridation. That's the gold standard. There isn't good research. We're all speculating, and this is why, before anybody starts manufacturing a drug and marketing it to people, especially without their consent, they need to get FDA approval, because it's the FDA that have the experts, the epidemiologists, the toxicologists, the pharmacists, all of these people who know how to evaluate a substance and use that judgment. I'm using my judgment. I disagree with fluoridation. Dr. Pollock uses his judgment, and he says, yes, we need to fluoridate. Well, what we need to do is take Dr. Pollock's and mine and take it to the FDA and say, let's have you review it. And you know what the response of the FDA, the latest one that I saw, was? Yes, it's a drug. Yes, it needs to be approved. but we're deferring regulatory action. That's kind of like the policeman sitting there with his radar gun on, and the mayor goes speeding by, and the policeman sits there. He's deferring regulatory action with cause.
The next question. The proposal in Sonoma County is to add fluorosilicic acid to our drinking water supply. What's the difference between fluorosilicic acid and the calcium fluoride that occurs naturally in the Earth's crust and in water?
One of the good things about nature is that when they have a chemical, they often have something else that's neutralizing that chemical a little bit. When fluoridation first started, it was because they thought it was the fluoride that was causing the benefit. But if you look at those places, they also had high calcium. Fluoride and calcium love each other. So when you take a calcium fluoride and you look at the toxicity of it, it's not toxic. It's when you take the fluoride and put it with the sodium as a salt. Or you take the fluoride and you put it with other silica fluorides. Then you start having a highly, highly toxic substance that is defined as a highly toxic substance, a poison, by every state in the nation. So it is completely different what nature has compared to what we have. There are two kinds of fluoride that are predominantly put into the water. One is sodium fluoride and the other is hydrofluoric acid or silica fluorides. None of those are pharmaceutical grade. They all have waste products in them. The hydrofluorosilicic acid is the worst.
It contains arsenic and lead.
What long-term peer-reviewed studies can you refer us to that have investigated the effects of ingesting fluoride for children, infants, children, athletes, seniors, kidney dialysis patients, and other potentially at-risk segments of the population in fluoridated communities? So what long-term peer-reviewed studies are there?
None. Okay. Want me to continue? I mean, that's the problem. There are no long-term peer-reviewed studies that are double-blinded, gold standard. And so what we're doing is fluoridating without safety. Now, there are some studies of the National Academy of Science, 2006, collected the greatest number of studies to that date. It was the best, we all agree on it, but I don't hear proponents having really read it. In Pollux, if you looked at the research on it, he was quoting the Center for Disease Control, not the National Academy of Science National Research Council. He didn't go to the source, he listened to the CDC respond to it. He needs to read the research rather than just quote. When they talk about cost savings, those are estimates of assumptions. When you read the data, it's estimates and assumptions. This is why Mount Holmes data that I showed was measured data. It's the only measured data available. Everything else is, we assume it's beneficial, we'll estimate that it's 26%, and this is the estimated cost, and it's all just dental decay that they look at. They don't look at total costs.
Thank you. The Institute of Medicine Dietary Reference recommends an adequate daily intake of fluoride for adult males of 4 milligrams a day. Is fluoride really an essential nutrient? And if fluoride is an essential nutrient, doesn't the amount we get depend upon body weight and daily water consumption? And what about infants and athletes, for example?
Okay, you brought up two huge questions right there. Don't mean to grab, you grab my arm, I'm stealing that mic. Okay, as a nutritionist, one of the things that we did a lot in my master's program was studying how you determine whether a nutrient is necessary. So they'll take a group of animals, but then they take people, and they reduce that nutrient until they start to see the disease develop. Okay? And then they say, that's what's the bare minimum, and now we're going to double that and probably quadruple that to have the recommended daily amount of that nutrient to prevent the disease. The absence of fluoride causes what disease? There's no disease. You can have no fluoride. The lack of fluoride doesn't cause disease. So how can it be an essential nutrient? It's not. These are some dentists that added it to it as saying adequate intake. Adequate intake for what? It's 1940s studies. And that was cooked data, unfortunately. Even now, the EPA's dose response analysis, they can't find any studies after that 1946 study that come anywhere close to giving good data. So they rely on the 1946 data. There isn't good research.
Thank you. There are some really good questions coming in from you, so I'm going to cut short my questions and move over to the audience questions almost immediately. But I would like to conclude with one question from me. The back of my truck says paradigm shift happens. So my question is, we see all the symptoms of a paradigm shift in our understanding of fluoridation. Many proponents of fluoridation in many scientific publications seem dismissive of new research findings about the effects of fluoridation. Opponents have their own peer-reviewed publication. Why do you think the science of fluoridation is so contentious?
I think when you sit down with thinking scientists and you look at the research together slowly and calmly, there isn't a lot of contention there. There's a lot of science that we agree on together. If the scientists look at both sides of the research, if they just look at the American Dental Association side of where they have collected the data to protect the dentists through fluoridation, it's going to be one way. If you look at the data on both sides of the research, I don't think that the data is that contentious. And I think that's why the Europeans said no to fluoridation and fluoride salts and fluoride supplements primarily, predominantly. So the question was contentious issue on the research, right?
Yeah, I mean, it's as contentious as climate change.
Okay. Contentious as
Yeah, why has it got to this state? On something that
let me give you another illustration. In my master's program, the last course said, you in public health, it is not your duty to understand the science or determine the science. It is your duty to promote the science. So everyone in public health is only promoting policy. They're not looking at science. And that's one of the biggest problems. Public health doesn't look at science. They look at policy, and the policy is supported by some reviews. They also tell me to stop.
Thank you. So I'll start with the question from the audience in the largest handwriting. I'll paraphrase it since it's quite long. We hear that all residents of Kentucky get fluoridated water, yet Kentucky has the highest rate of tooth decay in the United States. What's your take on this?
It doesn't work. I mean, it's pretty clear. You know who has the highest edentulous rate of any state in the nation? Kentucky. Do you know who was given an award for 100% fluoridation in the states by the American Dental Association? Kentucky. I mean, Kentucky has serious decay, and it hasn't helped. But you know what their diet's like down there? Have you ever been down there to the South? Man, it is fried food. It's so good.
Would you like to add anything, Dr. Wilson? No? Okay. Another question from the audience. Since the pro-fluoride advocates are not here, could one of you answer for them my question, the audience member's question? How do you justify dosing all public members with fluoride when they admit fluoride is not safe for drinking for infants or breastfeeding mothers? A significant portion of the public. What kind of liability would be assessed for unintended ingestion by infants and breastfeeding mothers? Will there be some kind of survey or study to find out potential consequences of ingesting fluoridated water by infants and breastfeeding mothers? So the liability issue, the follow-up, the responsibility is the question.
And that goes back to the risk versus benefit ratio again. That's the very issue. We cannot put it in the water where people cannot control how much they take and who gets it. All of us are different. And that has to be something that's done between the doctor and the patient. It doesn't need to be in the water.
Okay, I'm going to put on a different hat. Okay? I'm going to try to respond for Dr. Pollock. And I won't put words in his mouth, but I'll try to respond for him. There have been 15 times when the fluoridation has been reviewed by highly competent scientists, and they have found that it's safe. Every time it's gone to the committees, it's been found to be safe. And he would stand behind all those committee reports. And I would sit there and say to him, yeah, but all of the people chosen for those committees had to have sworn allegiance to fluoridation before they're put on the committee. I was on one of the committees, not listed there, but another one, and I was kicked off as soon as I started showing the research on the effects to the bones, to the thyroid, to the kidneys, and to the brain. And they said, out. So it is, the committees have been crooked. They have been rigged. The National Academy of Science is the first one. The chairman said this is a historic committee, that the first time the two proponents of fluoridation, and one of them was not a proponent, and two proponents of fluoridation were permitted on a review. All the rest of the time, they've not been permitted on.
Another question from the audience. What can you tell us about the effect of fluoridated water on pets, cats, dogs, and maybe horses too?
Well, what I found in researching it, that fluoride has killed more animals than any compound on the earth.
And I think that's not fluoridated water, but I think that's the use of fluoride has killed them. However, there are many factors for the absorption and excretion of fluoride, and one of them happens to be altitude. The higher you live in altitude, the worse it is. And so if you look under, somebody help me here, lady in Colorado who had...
Kathy Justice.
Yes. Kathy Justice. If you, and I don't know what the name of the video is, but there's a video of her horses, and she, you know.
At the risk of losing my status as an impartial moderator, if you YouTube JUSTUS horses, it will come up as probably the first YouTube search result.
And look at the video there, and it'll tell you about the animals. My daughter does anecdotal things, and we lived in Idaho, 2,000-foot elevation, and our horse had problems. And they always wanted to eat snow rather than to drink the fluoridated water. But she feels like there's a lot of good research. I don't have a lot of that. I looked at hers and I said, whoa, this is bad. But as a dentist, I don't prescribe it to horses. So it is a problem for animals.
Moving on beyond pets and horses, what are the risks to our environment, water table, wild animals, fish, things that live in creeks, from wastewater that contains fluoride that passes through wastewater treatment plants?
Okay, again, environmentally, it's better to talk to an environmentalist scientist than myself. However, in the Columbia River, there have been two different places where fluoride has been put out into the river. And what they found is they were having problems getting the fish to climb up the fish ladders because of the higher concentrations of fluoride in the water. They reduced the fluoride and the fish went on up okay. And what puzzled the scientists is that the ocean has a fair amount of fluoride, but freshwater had less fluoride than the ocean, and the fish were having problems with the fluoride in the fresh water. And that's partly due to the partial pressure of the other elements, the other salts in the ocean. So it does have an effect, and this was one of the big factors in Oregon for the legislature to say we're not going to mandate fluoridation, because if it's not good for the animals, for the fish, we don't want to hurt the fish. Well, you know, if it's not good for the fish, how can it be good for us?
Another question from the audience. What is your opinion of the use of fluoride in the form of periodic topical varnish applications on the tooth by a dentist? One for adults, two for children, instead of drinking fluoridated water. Is this advisable? Are there drawbacks to fluoride varnishes and topical applications?
That's an excellent question, because the research shows that topical fluoride in people who have rampant caries has some benefit. In other words, if somebody comes into me and they've got a soda pop in one hand and a Mountain Dew in the other hand, fluoride varnish might help them. In all other cases, the research is incomplete. So there might be some benefit there. Now, the latest study that I saw was out of England, and what they did is they took elementary school children, it was just less than 1,000 children as I remember, and they gave them fluoride varnish at 22,600 parts per million. Now water, it's about 1 or less. This was 22,600 parts per million, and they took it on varnish. That is, they painted it on so it would stay on there as best as possible. They did that 3 times a year for 3 years, and at the end of the study, guess what the results were? No benefit. It's not FDA approved. Some children have serious problems from it. So to give, and I'm working for an employer right now doing dentistry, and the employer wants me to sell fluoride varnish. They want me to sell it. They're pushing me to sell it. And I say, I'll sell it. You get it FDA approved and I'll sell it.
I will speak to that. I have used fluoride with trays for people who have had cancer and had head and neck radiation and had caries from that. So I have prescribed it in high dosages in the trays to be used at home. But again, we went over everything and the patients made an informed choice when they chose to do that. I have had several of my patients completely refuse to do it. And that's fine, that's their decision. They were able to make that choice with their doctor.
Thank you. Another question from the audience. What effect does fluoridation have on the growing fetus when a pregnant woman is drinking fluoridated water?
Unfortunately, nature left us out on that. Fluoride does pass through the placenta to the fetus, to that very tiny few cells as they are dividing. It's an enzymatic reactor, and so it causes serious damage to the developing infant. In animals, we find that there's a decrease in brain intelligence of running through the maze and everything for the mice when fluoride increases. We also find that the decrease in intelligence for the mice lasts. If they give the fluoride and cause the brain damage to the mouse, that mouse's children, grandchildren, and great-grandchildren still have intelligence defects. So the fluoride that you're putting in the water now will last, the damage from that will last for probably 70 to 100 years. This is why you need to have everyone that you can knocking on doors and pulling people on in when Paul Conant comes next time. This place needs to be packed. I sense that there are a lot of proponents here, and that's wonderful. But you need to get the courage and the guts to say, I don't want this for my children to have the reduction in brain function of the members of the community. We are a community. It all
In the 1940s and 1950s, there were some inconclusive studies of fluoridated and unfluoridated communities. Why haven't any of these paired city fluoridation studies been done in recent years between fluoridated and unfluoridated communities?
Okay, back to the research. The research that was done at the very beginning has not been duplicated because our standards for research now are higher. I have a slide that goes over about 15 different areas where the research is incomplete, that it's defective, that it's not good. They say that it can't be done, quality studies, because you can't do a randomized peer review. What are you going to do? Run 2 pipes to every house? Are you going to make sure that one's not drinking the bottled water? This is just too complex. Can't be done. Well, it can be done. There's just not a will to do it, because it would be expensive, in my opinion. And so, therefore, they have to rely on research that is not good studies, and the recent studies don't meet standards. How are you going to go to the university peer review boards and have subjects not be given consent for research on them? I mean, that was what was done by the public health agencies when fluoridation started. You heard of the studies on syphilis. You've heard of the studies that the public health has done, and it lasted for years, generations of people who were harmed because of the studies. They can't do that now. That it's much more strict than it was in the past.
Another question from the audience. How can we protect ourselves from ingesting fluoridated water if water gets fluoridated here? What ways are there to remove fluoride from drinking water in the home, and what sort of financial impact does that have on the homeowner, the water user?
I contacted one of the head water people here in Sonoma County, Brad Taylor, and I asked him that question, and he said that the only way to get it out would be with reverse osmosis, and it would cost about $500 to $700 a unit. He couldn't tell me if it could be removed from bathing water, shower and bath water, but it could be removed at the faucet water that you drink. But you have to consider too, you know, like we were talking about the halo effect. If you travel, if you go anywhere, if you go to the city and you are in the city all day and you don't have your water with you, you're drinking fluoridated water again.
Yeah, it is very, very difficult to get it out. Reverse osmosis is best. Buying bottled water is another way of doing it. Ionization. Some bottled water has fluoride. You got to make sure it doesn't have it. Ionization. But I think that's a very short-sighted question. I love it. I want it. I want to just ask that. But I think it's very short-sighted. Because when you say, I'm going to protect me and I'm not going to protect my community, it's kind of a selfish answer. We need to get it out of the water because it's hurting our communities. Is a tripling of the special education students in the community not affect you? Of course it does. Will it not affect your children and your grandchildren? Does the increase in diabetes, does the increase in arthritis, does the increase in these other diseases not affect all of us? Of course you want to protect yourself, but you also need to work hard to protect your community. We are all here together. Our taxes go up when we cause damage to each other. We need to give freedom. If somebody wants to smoke, and I mean, they want to drink soda pop lots of it, that's their choice, and I suppose we have to bail them out. But it's something that we really need to not force them to do something that's hazardous like this. Freedom of choice.